Hello to all of you. Achan Chidao. So I've been working as a legal and medical interpreter for 19 years, particularly here in Pinellas County, Florida. All areas of Pinellas and amongst all areas of medicine, from OBGYN to neurology, psychiatry, family medicine, urgent care, endocrinology, oncology, hematology, you name it, across the board. And I waited for a very long time to dissent on this subject because, Buddhist monks tend to leave everything alone and they typically, aim at their own defilements and liberation and enlightenment. They don't really get into social stuff. But this is falls under right speech, I feel. Aware of which, when I was working with physicians, I would hear them argue on the phone. Very frustrating. Doctors have to see like 30 patients a day. Getting on the phone with insurance company and, putting them in their line, such as, quote, you went to the same medical school as I did. You're not seeing the patient, I am. And how are you going to dictate what I can and cannot prescribe to my patient? Furthermore, across the internet, we see multiple reports from actual doctors treating physicians who have reported delays and denials, delaying precious time that people are suffering needlessly. Heartbreaking. $4 trillion industry in healthcare, and we have so much despair. The amount of messages seen online is the alarming statistical number that is not a surprise to all of us in the medical field, directly in the medical field. When I used to show up to work, there used to be insurance change all the time. Like who's taking what and who's not taking what. Sorry, you're not in what network. You are in network. What is your deductible copay? And it's so confusing with the language. How is it that we have a $4 trillion industry with MD, PhD, MPH people out there working for y'all, health insurance, and you can't seem to decipher, distill, disseminate vocabulary for the general public who have high school level education to understand so that they can make informed choice and understand the process, leading to so many people cussing you guys out. They don't know how to do appeals because it's like an act of Congress, for appeals, and the wait time while people are suffering with the current existing disease. Right? It's easy for y'all to make a decision when you're not the one that is going through such pain, sorrow, misery of whatever disease in the ICD-10 that is presenting at that time. So I hope that this really shake America up. Obviously, it's had to resort to violence. In America, when you look around, it's like somebody somewhere down the line had to die for things to like happen. I don't know why it has to lead to that. In Buddhism, we don't condemn violence, but it's like America's civilization very dumb. It's like 300 years young, less than 300 years. And it's like, just like no one listens to anybody. And something tragic has to happen in order for them to, tighten up and kind of like, oh, well, maybe we should start changing things, the way how we do things and the way how we explain things. That's a little too late. Somebody died. And other people also died. The patients who waited for delayed care, just delayed care. And along the way of their family and the many brain cells that got fried trying to get their point across. The grief, the headache, the heartache for everyone involved. Doing prior authorization, referrals, and all of the medical staff that gets the long end of the stick. I was there. I picked up the phone. I know how the procedure works. 19 years watching this unfold. Failure in the system over and over again. I hope some of y'all CEOs out there that are watching, now you see a Buddhist monk getting involved. And the voice of a Buddhist monk advocating for the people. And your decision should always for the people, for the welfare, not for the money. It should never be profit over people, ever. And of course, now the conversation has emerged about how it is for profit. Healthcare is for, some of y'all is in it for profit. Stakeholders, shareholders. How do you go to bed at night knowing that you are in it for money, watching people die? People die as you're sleeping. People are suffering, bleeding to death. Ulcers, cancers. Test results shows with direct clinical evidence of what it is showing right there and then. And yes, I'm very well informed of insurance fraud. I'm very well aware of the investigative process and how much it costs healthcare. I see both sides of the table. But you all can see now the statistical numbers of the masses of the crowd, the masses of the suffering of the people. And when we get like this, it's bad. And furthermore, at the time of this talk, I still don't have my medication that I need. I'm being denied. And I don't take it personal, by the way. It's probably due to my karma. But I'm advocating for the people, and it should always for the people. And the Buddha gave leaders instructions on how you should conduct yourself and always put the welfare of the people first, before your own, before your company, before above anything else. You do that, people talk, and they're like, you know what? Wow, this company is great. They're all about people. They do it quick. They figure it out, folks. $4 trillion industry. Figure it out. How much money do you need? How much money do you want? And how you're going to evenly distribute this to hire people and make things more simple. Buddhism, simplicity is happiness. Simplicity solves a lot of problems. Don't need to get complicated. Everything else in America is complicated. Law is complicated. Medicine is complicated. Academic is... Everybody got their own sets of vocabulary that nobody understands. It's like, hello? And if we don't understand, how can we communicate? And if we can't communicate, how do we get things done and conduct business, day-to-day operations? Food for thought. That's it. Again, try to solve this quick with wisdom, love, compassion, and understanding for the people, for the patients, always. My blessing to all of you across the world and in the United States as we're watching this unfold painfully, slowly, but we will get through it. All things are impermanent. May you all be well, be happy, be free, and always be healthy. If you have any questions, you can reach out to me at the #1 Vietnamese interpreter at gmail.com. I hope that this lending voice falls on the right speech in Buddhism and that it helps everybody get on the same page so that we can just cohabitate peacefully in this very small world. Everyone is subject to birth, old age, disease, decay, and subsequent death. When we see suffering in ourselves and other people, we are less likely to cause direct suffering. And we would make better choices because we don't want to accumulate negative karma, create negative karma. And some karma just comes fast, and some karma just comes slow. So again, take all of this into consideration. Take care, folks. Till the next time.